Hello, we're going to go over almost last week. And this week in the module, if you go to the module, and hopefully you've seen how this has been organized by modules, and you're going down to week 14. And in this week, we're going to be covering local information on treatment services. Now, this is super important for your final project, because one of the questions in your final project that you need to have answered is this. If you go to the rubric, if you move to the assignments and you go to the final project, which you've done your outline, and I've talked to you about that. But in your final project, one of the areas that you need to talk about is describe what resources are available to support addiction treatment in Kern County for the drug that you're focusing in on. That's worth 20 points. And so to answer that question, this week, we're going to be talking about that, and I'll show you a presentation that the Kern Behavioral Support Services gave. So taking a look at that, it's in your module, and we're going to go over here. This is information that the Behavioral Health and Recovery Services put together. Now, here's the thing. They used to be called Mental Health Services, and they switched to this name. So, pretty new marketing. So we're going to be talking about substance use disorder treatment services in Kern County. Anna Alvera is the person who put this all together, and she presented this presentation in class, and it's a great PowerPoint. So she did a great job putting it all together. And I'm also going to show you some data at the very end that shows you what are the most common drugs used in Kern County, or the ones that are getting treated the most. So one of the big things is that you need to know is that there are different levels of care for substance use disorders, or SUDs. And then in Kern County, we're going to be talking about the treatment services that are there, and that there are barriers to entering treatment, and then the resources that are available. So who needs SUD treatment? When it starts to interfere with school, loss of control over amount of frequent use, when someone starts to get into horrible, hazardous situations, cravings, tolerance, and of course, someone has a physical withdrawal. There's something called outpatient treatment. And outpatient treatment is when they're assessed, there's a treatment plan, there's usually group and individual services. It's supposed to increase the motivation for recovery and to completely quit the drug, and to figure out skills. There's 90 days to 6 months of outpatient treatment. Then there's something called intensive outpatient treatment. And this is when people start to go into more frequent and intensive services than an outpatient. And then this can go for 90 days, and then it continues to follow the patient. Then, of course, there's something called residential. And this is when someone goes into a licensed facility. And I want to say that there are not many treatment facilities here in Kern County that are residential. Youth treatment facilities, you'll be pressed to find any in Kern County. So this is something that we're kind of really struggling with here in Kern County. But clinical services, they work on socialized activities, daily living skills, and the time is from 30 to 45 days to stay to prepare for outpatient treatment. So they go in residential, and then they go outpatient treatment. So residential means they're in an actual licensed facility. One of the big things is opiate treatment services. That's a big pressing concern. They have a physical exam, medication to get them off of opiates. There's a clinical assessment, a treatment plan, and then individual services. Medications are meant to block the opiate receptors to prevent the withdrawal syndromes, which are not fatal, but they're horrible, and often people will go back to the opiates. Methadone, you can see the other ones that are used to get people off. So you can see this is just weaning off of an opiate using a drug. One of the big things is that you need to know that in California, 6.7% of individuals are dependent or abuse alcohol. 2.7 individuals 12 or older were dependent. And then 5.6 adults reported heavy alcohol use. So you can see that in 2015, 1 in 12 people needed substance abuse treatment. And then over 10% of people need substance abuse treatment. So you could just do the math on that. 1 out of every 10 persons will need some kind of treatment. So addiction is very, very common. Why people don't get it? Think about it. They think they don't need it. They're ashamed of asking for help. They don't have insurance because sometimes, a lot of times, treatment services are not covered by all insurances. They might not be able to get it in a geographic area. I mean, think about it. If you look up at the treatment services for your drug and how people get it, you'll see that they struggle with it. And then they might, again, if it's not covered by insurance, they can't afford it. But here are the local sources. So there's obviously private insurances. If they're on Medi-Cal, they can go to Kern Behavioral Resources. That's mental health services, or what now is called behavioral health resources. No insurances. And then there are community support groups, which are not exactly treatment. They are support groups. How does someone get help? And I'm going to be looking for this in all of your community reports. So if you don't have this, I'm going to be saying it's in the PowerPoint. Individuals can call the Gateway team at 868-6453 and get referred to the closest treatment services near them for the appropriate treatment services for their drug that they need to get off of. They need to be screened to determine the appropriate level of care, and then they're given referred to the appropriate provider. This is really important because, as you know, with each drug, treatment is different for each drug. So these are the different references out there. Again, this is the Gateway number that you should put in your report. And then this is the crisis hotline, that if anyone's ever in crisis, someone can immediately get help. So that, again, look at that PowerPoint. And again, I'm not going to put this answer out there. You need to pull it from this PowerPoint, and I'm going to give you a big, huge hint, okay? The next thing I want you to look at is I want you to look at your, in your book. Now, I'm not going to read these PowerPoints to you. Trust me, I won't do that to you. But I want you to go through these and read through them about how there are different types of prevention programs, okay? And one of the big things is really looking how an environment sets up a person. So you can look at these and look at the different rates of dependency. We know that. What is considered dependency. But one of the big things I want you to know is protective factors and risk factors. Protective factors are things that keep someone from ever getting addicted to drugs. In other words, it protects them. So their ability to do self-control, parental support, parental supervision, academic competence, anti-drug use policies, and then a neighborhood around them that supports them. Risk factors are different than protective factors. Protective factors actually protect, right? Like keep that person safe. Risk factors are actually exposing someone to something. So that's a lack of parental supervision. So someone being exposed to it because they don't have any parental supervision. They get into a gang. They're exposed to it. They go to a party and someone's constantly exposing them to drugs. So I really want you to know the difference between protective factors and risk factors. Let's see else. This is the other big things. If you think about it, there are different levels of prevention, and then there's different levels of how to keep someone safe. But again, the two big things I want you to know are these: protective factors and risk factors, okay? The other thing I want you to go through is look at the treatment dependence treatment. And I just give you an overview of treatment programs here. But one of the big things that there's different theories around this, and this is something you'll hear a lot of, is called brief intervention. And this is where they screen the person and they do a short interview to determine the level of services. So it's SBIRT and screening brief intervention. So you'll hear that terminology. And so one of the big things is that there are different types of treatment based on this screening. So it could be behavioral treatment, counseling. Psychotherapy is where they do an analysis of the past. Cognitive therapy is really working on changing how they think. So like every time they start to think about a drug, then they start to do a mind shift. So that's like how someone thinks. And then pharmacological is using actual drug treatment. Okay, so go through this PowerPoint, read through it, and get familiar with the different types of treatments. But again, my biggest thing that I wanted you to get to your biggest takeaway today is to know that these are the treatment services in Kern County and how to get that information. Again, that's the number. Read your book around treatment services and prevention and get that wrapped around your head. But most importantly, know that there are services in Kern County and that knowing how to refer someone is very important. Okay. 2 ideas, again, the number and then the crisis. These are right in this PowerPoint. Okay. So screening and referral. Screening by trained people who know how to do this, and then referral. And what are those 2 numbers? Again, you would call the 868-6453, and then also there's the crisis hotline. Now, one of the big questions that I asked her was to provide data on what are the services that are most accessed here in Kern County, and this can go into your report. Oh, it's not here. I'm going to have to upload it later. This is just a PDF. So one of the things, I'll take a picture and I'll upload it later with the actual what is treated here the most. But I can tell you off memory, the first one is meth and the second one is opiates. Now, the big thing again is making sure that people have access to services. If you want me to give you more information on that, I will go ahead and post that here later in the week. But right now, again, remember those 2 numbers and remember the referral. Okay, and I'll be posting that picture here within this area. Okay, so you got that right. SUD, download this and pull those 2 numbers off. I think I've said it about 16 times. So you know where to look for that. If you don't know that information, again, download the PowerPoint, get the phone number, and get the referral criteria, which is the crisis management and the 868 number. All right. Any questions, make sure to give me a Canvas message or give me a call and on my Google phone.